Toby podhaler, tobramycin inhalation powder, 28 milligrams per capsule, is a prescription inhaled medication for cystic fibrosis patients whose lungs contain bacteria called Pseudomonas aeruginosa. It is not known if Toby podhaler is safe and effective in patients under 6 years of age, in those with lung function outside of a certain range, or in those whose lungs contain bacteria called Burkholderia cepacia. You should not use Toby podhaler if you are allergic to it or to any other aminoglycoside antibacterial. Stay tuned for additional important safety information in this video.
When Jax was born in 2008, he was diagnosed 8 days after his birth. When he was first diagnosed, life felt more fragile. For a while, it felt like we were living in a fog. Parenting a child with CF is a challenge in of itself because there are times where your thoughts can get the best of you. It is easy to let your mind wander if you aren't careful. The most important thing that we've learned about Jax's diagnosis is how important it is to live in the moments and never take moments for granted. One of the things I want people to understand about living with CF is that it is a daily battle. Even when you think that you are going through the motions and not thinking about it, it is something that can wake you up in the middle of the night with worry. It lives in the background and never leaves. We stay motivated by looking to the future and knowing that what we do now can make a huge impact in the months to come. What I want the CF community to know about our family is that CF has strengthened our family. It has connected us to some really amazing people. CF has tried us in so many different ways, but we as a family keep picking ourselves back up and bouncing back.
The support of my family has been invaluable in my journey with CF.
Toby podhaler, or tobramycin inhalation powder, 28 milligram per capsule, is a prescription inhaled medication for cystic fibrosis patients whose lungs contain bacteria called Pseudomonas aeruginosa. It is not known if Toby podhaler is safe and effective in patients under 6 years of age, in those with lung function outside of a certain range, or in those whose lungs contain bacteria called Burkholderia cepacia. Important safety information. Do not swallow Toby podhaler capsules. Toby podhaler capsules are used only with the podhaler device and inhaled through your mouth or oral inhalation. Never place a capsule in the mouthpiece of the podhaler device. You should not use Toby podhaler if you are allergic to it or to any other aminoglycoside antibacterial medicines. Tell your doctor before starting treatment all of your medical conditions, including if you have or have had hearing problems, dizziness, kidney problems, muscle weakness, breathing problems such as wheezing, coughing, or chest tightness, if you had an organ transplant, are pregnant or nursing, or plan to become pregnant or nurse. Toby podhaler contains a medicine that can harm your unborn baby. It is not known if it passes into breast milk. Check your baby for watery stools, bloody stools, thrush, or diaper rash if you breastfeed. Tell your doctor about all the medicines you take, including over-the-counter medicines, vitamins, and herbal supplements. If you are using Toby podhaler, discuss if you should take other medicines that may harm your nervous system, kidneys, or hearing. Water pills or diuretics such as etocrin or ethocrinic acid, Lasix or furosemide, or intravenous mannitol, urea. Toby podhaler can cause serious side effects, including severe breathing problems or bronchospasm. Tell your doctor right away if you get shortness of breath with wheezing or coughing and chest tightness while using Toby podhaler. Hearing loss or ringing in the ears or ototoxicity. Tell your doctor right away if you have hearing loss, noises in your ears such as ringing or hissing, vertigo, difficulty with balance, dizziness, or your mother has had hearing problems after taking an aminoglycoside. Tell your doctor if you have been told you have certain gene variants, a change in the gene related to hearing abnormalities inherited from your mother, worsening kidney problems, or nephrotoxicity. Toby podhaler is in a class of medicines that may cause worsening kidney problems, especially in people with known or suspected kidney problems. Your healthcare provider may do a blood test to check how your kidneys are working while you are using Toby podhaler. Worsening muscle weakness. Toby podhaler is in a class of medicines that can cause worsening muscle weakness in people who already have problems with muscle weakness, myasthenia gravis, or Parkinson's disease. Toby podhaler is in a class of medicines which may cause harm to an unborn baby. The most common side effects of Toby podhaler include cough, worsening of lung problems or cystic fibrosis, productive cough, shortness of breath, fever, sore throat, changes in your voice, hoarseness, coughing up blood, and headache. Let your doctor know if your symptoms worsen or if you have a side effect that bothers you enough to stop treatment or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information and patient information.